It's 1:13. I'm Sandy Kozel. Thanks for being with us. A doctor who practices in Northern Virginia is reminding folks about the increased risk of heart attack from shoveling in cold temperatures. Dr. Seth Meltzer is a cardiologist with Virginia Heart Medical Practice. Thanks for being with us. Now, maybe this won't be the case if there's ice on top of snow tomorrow, but snow shoveling is something that can be deceptively strenuous, right?
Certainly. I mean, it's a significant amount of work, more so than people realize. It's what we call isometric exercise. And there's been studies that shown that after a couple minutes of snow shoveling, people can get their heart rate up to similar to what we see on a peak heart rate on a stress test.
So do you really see a spike in heart-related emergencies after major snowstorms?
We do. There's a couple of reasons for it. One, as you said, it's a significant amount of exertion, especially people have been more sedentary during the winter. The other reason we see is the cold weather causes vasoconstriction, so your blood vessels in the periphery constrict and raises your blood pressure, and even the coronary arteries, the arteries of your heart, constrict. So both of those increase strain and pressure on the heart, and that can lead to chest pain, ischemia, and even severely a heart attack.
So who's at risk? Who should not be out shoveling snow?
So people who have known established cardiovascular disease, they have, coronary artery disease, prior history of stents or bypass surgery, those patients really should not be shoveling. People who have, symptoms of angina, who do activity and get pain in the chest, they really should not be shoveling.
And even if you don't fall into any of those categories, is there a way to warm up or to take your time in what you're doing when you're shoveling snow? What do you suggest?
Yeah, I mean, the main general advice we give to people is certainly you want to warm up when you start. You want to take frequent breaks. You really want to push the snow instead of lifting it, and really stay warm.
And how important is it to not push through any symptoms that you might suddenly have while you're out shoveling?
Extremely good point. If you're, the symptoms we would look for are if someone has, pain, tightness, pressure in the chest, if they have, a racing or a regular heart, severe shortness of breath, they really need to stop and rest. And certainly if those symptoms don't go away after a couple of minutes, they need to call 911.
Okay, well, thank you very much for the advice.
Thank you, Sandy.
That's Dr. Seth Meltzer, a cardiologist with Virginia Heart Medical Practice.